morning. Welcome to Plastic Surgery 90210. My name is Ariel.
And I'm Dr. Katzen.
And today we're going to be answering all your questions about plastic surgery after massive weight loss. Right. This is part 2, so go check out part 1 if you haven't already. First question is, do patients typically need to lose more weight before surgery, or is it okay if they still have a few pounds left to go?
I would suggest you try to reach your goal weight or your ideal body weight before plastic surgery. It's exceedingly rare, like I can't think of a single patient, 25 years, that we do the plastic surgery and then they lose so much weight after the procedure that they need a revision. Okay, so it's exceedingly rare. We have patients that, have lost 20 pounds, 30 pounds, all the way up to, I think, about 600 pounds, okay? So it really depends on the patient, okay? But ideally, you lose the weight, diet, exercise before the surgery, your body plateaus out for about 3 months, then you're ready for plastic surgery. But if you're like 200 pounds and you want to be like, I don't know, pick a number, 150, it's better to lose that weight before the plastic surgery as opposed to after.
Can you explain how you can remove more skin when you're as small as possible?
Yeah, so patients that get the best results have lost the most weight possible and are healthy, okay? Maintain that weight for at least 3 months, and then the skin is ready for surgery. Now, patients, when you lose weight, you lose fat, okay? You lose a little bit of muscle, but primarily it's fat. So patients that get the best result don't have much fat, and they just have a lot of excess skin.
Yeah, and I think about when you're opening up the tummy and then we look at, the tummy and the rectus muscle and stuff. The patients who I think get the best results have a very small frame under there because they don't have a lot of visceral fat either.
Correct. So the visceral fat is the fat that's over your viscera. What is viscera? Viscera are your internal organs. So the visceral fat really is a thing, a sheet or an apron of, it's called omentum, which is basically fat that's around your intestines, all right? And then that fat around the intestines pushes out the anterior abdominal wall. So if you think about the six-pack muscle from behind, your stomach and intestines are really pushing that cavity out. That's the peritoneal cavity. So that's the visceral fat or the fat behind the muscle, and the muscle is the rectus abdominis muscle.
So there's only so much you can do when a patient comes in with a lot of visceral fat, huh?
Correct. So when patients' tummies stick out, so when you're looking at somebody on profile and the tummy sticks out, it can stick out for usually 2 reasons. One, the visceral fat can be pushing the anterior abdominal wall out, so the tummy sticks out, and maybe you have a little layer of fat. Okay, so that's visceral fat. Okay, same picture, tummy sticks out, but they have very minimal visceral fat because the tummy is nice and flat, and they have a thick layer of fat. So the patients that do best are that secondary patient, the patients that have the thicker fat. So you have to get rid of the visceral fat first to get that tummy tucked in.
And how do people get rid of their visceral fat?
Diet, exercise.
Okay.
GLP-1s, gastric bypass.
It can't be liposuction down.
Correct. Visceral fat is, again, behind the muscle. We don't suck out the muscle. We don't suck out the fat behind the muscle.
Dangerous.
Nobody does it. Yeah.
Okay. Yeah. All right. How important is skin quality when deciding what can and can't be done during surgery?
Skin quality. So most people's skin quality is pretty good.
And this kind of reminds me of like a liposuction type question,
Yeah, so again, we're talking about weight loss patients here, patients that have lost at least 100 pounds or more. So typically those patients, the skin's been stretched out with their weight gain. Think of an elastic band, rubber band. Think of a rubber band. So the rubber band has been stretched out. And it's been stretched out not for like 5 or 10 minutes, but years, okay? And sometimes it's been yo-yoed up and down. Weight gain, weight loss, weight gain, weight loss. So a lot of those elastic fibers in that rubber band have been stretched out, and basically they break after a while. Same thing with the skin.
Causing stretch marks?
Correct. That's one theory of stretch marks. It's the breaking of the bands, okay? Also, it loses pigmentation. So when we see weight loss patients in the office, by and large, most patients are going to need an excision of that poor quality skin. Because once we see a patient with 100-pound weight loss, areas of stretch marks in the areas we want to affect, that those areas primarily will do better with an excision of that poor skin, because we can't rely on that skin that has stretch marks and has been stretched out with that weight gain to contract predictably after liposuction.
Do stretch marks affect your planning of surgery?
Yes and no. I mean, the stretch marks tell us that liposuction may not be a good idea in this area.
But it doesn't make it more difficult to do or
harder
to close or anything?
Correct. So when we get in there, the stretch mark skin looks, we say grossly. When we look at things grossly, that means with a human eye, as opposed to under a microscope. Under a microscope, stretch mark skin is going to look different, but grossly when we're doing the surgery, it looks the same.
So do you believe that the longer you are obese with that skin stretched out, the more stretch marks you're going to have and the worse your skin quality will become?
Yeah, I think so. Again, I think about that rubber band analogy. The longer that rubber band's been stretched out, the more likely those elastic fibers are going to break and not going to be able to recoil.
And the older you get at the same time. So it's
Correct.
all like...
And age and genetics, they all factor into the ability of that rubber band to snap back.
What is the average age range you see for your weight loss patients?
Really depends. So typically we have age range, I would say maybe between about 35 and about 50 years old, somewhere in there. Yeah.
What's one thing most patients are surprised to learn after their first consultation with you?
I would say the one thing patients are most surprised to hear is that there are options, okay? A lot of patients have weight loss and then they weren't told maybe that they would have these areas of excess skin and fat. They just thought, well, I lose the weight and all my skin's going to shrink back. So they may not have been informed of, yep, you're going to have some excess skin. Yep, you may need this part 2 reconstructive plastic surgery after massive weight loss. And then when I think they come to the office too, they may not have known of the options.
Right.
Okay. They don't know, oh yeah, the pubic region can be corrected. Oh yeah, we can do implants. Oh yeah, we can lift the breast. Oh yeah, we can fix the back, and there are options to the back. Yes, we can fix the thighs. Yes, we can go down to the wrist. Yes, we can go down to the ankle if we need to. It just depends on the patient.
I think about the patient that we just did the other day. She was here yesterday for a post-op. She came in wanting a BBL, and she wanted, fat sucks from her back as well. And she had no idea how to fix her shape because it's been something she's been struggling with her whole life.
Yeah.
And we talked to her about the vertical torsoplasty, and she said it just completely blows her mind every time she looks in the mirror.
So it's it's very cool to, a lot of patients don't know of these procedures. That's what we're here to tell everybody about, these options for patients. And that vertical torsoplasty, it's an incision that goes from the armpit down the side, all the way sometimes down to the hip. And I call it the hourglassing surgery. I call it the hourglassing procedure because we can get you more of an hourglass. Because we take a large elliptical area on the side. It's called a vertical because it's up and down. But case in point, that patient may not have known about that procedure, and now she's extremely happy. So basically what I would suggest to all you out there, if you're thinking about plastic surgery, and you may not know the procedure you need, most people don't, go to your plastic surgeon, go to an experienced plastic surgeon that does this all the time, and there are a lot of options that can be done.
What do you say to people who are nervous about surgery in general? They could be nervous for many different reasons, the pain, the recovery, anesthesia.
Yeah, so I tell my patients, I'm nervous if you're not a little nervous. Okay, so the patient needs to be aware of, potential complications, things like anesthetic problems, surgical problems, bleeding, wound healing things, problems under anesthesia, blood clots, things like that. So those are all medical surgical risks involved with the surgery, and sometimes they do happen. Very rare though, okay? So you do need to understand these aren't risk-free procedures. Complications can happen, but by and large, usually it's pretty rare.
And usually we can talk to them through all of their fears and kind of find out what the root of it is. As far as anesthesia, everyone goes to sleep, everyone wakes up.
Correct. So by and large, the most common fear that I've seen for my patients has been anesthesia fears, fear of not waking up. And that's exceedingly rare in these types of procedures because, look, we order labs, EKG, chest x-ray. I use an MD doctor anesthesiologist, not a nurse anesthetist. We don't do these under local. And we use these in certified surgery centers, certified hospitals, and we're experienced. We do these procedures all the time. So complications are pretty rare.
What role does muscle tone or exercise history play into planning these surgeries and affect the results?
Muscle tone is important. I always advocate diet and exercise, a very, very important part of your life and your longevity. So muscle tone is important. It helps to define the body. And I would suggest as you're going into plastic surgery, keep up with your exercise, keep up with your aerobic exercise for heart health, as well as your muscle tone. Because the first thing the body burns after the surgery is your muscle, not your fat. So you want to build up a little bit of muscle mass before the surgery, so when your body's healing, it burns up that muscle mass first. But I've had some patients say, well, what if I bulk up too much? Is that going to affect the closure of the surgery? I've never had a patient build up so much muscle mass that it prohibits or it inhibits the amount of skin we take out.
Got it, okay.
Yeah.
Do you also feel like your patients that exercise and are maybe more toned get better results?
Yeah, I do. So patients that are more toned, more physically fit, less percent body fat do get better results because then we can really tighten the skin and really shrink wrap it around the muscles.
Right, then it becomes like as aesthetic as possible.
Correct.
Do you ever recommend patients not to have surgery or wait longer before proceeding?
Correct. So sometimes patients need to lose more weight. Sometimes patients have other medical comorbidities. Maybe their diabetes is still out of control. Maybe they still smoke. They need to stop smoking. So there are contraindications to surgery. So sometimes we get patients who have very unrealistic expectations, like they want me to remove 2 or 3 ribs on each side, shave down bone, things like that. So those are more the extreme outliers. Usually we can pick that up during consultation and sort of dissuade them from plastic surgery.
Do you ever recommend patients not to have surgery?
Yeah, it depends on the patient. It depends on what the situation is. Maybe they have medical comorbidities. Maybe they have diabetes that's out of control. Maybe they still smoke. They need to stop smoking before any of these procedures. Maybe they have high blood pressure or maybe thyroid issues. They need to get all those sorted out and under control before any procedures.
Okay.
Yeah.
And then what about like, I know you've talked about having breast reduction patients come in when they were still very obese and they were on the road to losing weight.
Correct.
But they wanted breast reduction and you warned them against that because their breast might shrink in the process.
Correct. So we have some patients who are obese and sometimes morbidly obese wanting a breast reduction. And I counsel them, well, you know, as you lose the weight, your breasts will change. You may lose all your breast tissue. So we had one doctor, in fact, that was morbidly obese and wanted a breast reduction. And we spent many hours discussing, you know, the need to lose the weight before the breast reduction. But nonetheless, she wanted a breast reduction. So we did the breast reduction. Breast reduction did great, looked fantastic. And then she showed up about 3 or 4 years later, and she had lost all the weight because she had a gastric bypass procedure, and she had nothing left in her breast. And she came back, and now she wanted breast augmentation. So she went from a reduction to an augmentation, whereas if she'd just lost the weight at first, she may have only needed a breast lift. So it just sort of depends. So if you're thinking about breast reduction and you're still overweight, lose the weight first.
Can you tell us about like some of the most unrealistic requests you've gotten from patients?
Well, we've had some patients come in the office and they want every other rib removed. So we don't do that. That's very dangerous. You need your ribs for breathing and things like that. But by and large, most weight loss patients do have realistic expectations and do have reasonable requests.
Okay. Do they ever come in with wish pics?
So we sometimes see that in the office. Patients will come in the waiting room, they'll have a stack of papers about that big, and they'll have gone on the internet and printed out all these pages, and they'll show you, oh, these are the pictures that they wish. And you'll see a lot of the pictures don't match. You know, they'll want, you know, tiny tummy, but on the next picture, they'll have a six-pack. And then we have to sort of wade through those pictures with the patient going, okay, what do you really want? Do you want a flat abdomen? Do you want excess skin removed, or do you want a six-pack? So a lot of the pictures help us get a sort of a picture in our mind of what the patient wants, but in the end, it's sort of only what we can do with the patient's body surgically.
Right, because just because they have a wish pic doesn't mean their body is framed like that.
Exactly. It's not a 3D scanner where we can take a 3D picture, input it in a computer, put you in the box, and you come out looking identical. It doesn't work like that.
What's the emotional journey like for patients going from weight loss to body contouring? And do you see big shifts in confidence or like even self-identity?
So we see large emotional roller coasters. All right. So patients lose the weight, and they're happy that they lost the weight by and large. And they're happy that a lot of their medical comorbidities are gone. Maybe their diabetes has disappeared, maybe their high blood pressure is gone. They feel better about themselves, they're able to exercise better. But a lot of the times they're sort of held back, if you will, because of the excess skin. So then they come and have plastic surgery, and we get rid of skin and some fat and really contour their bodies. And you can see their emotions just, go through the roof after that. Very happy and proud about their bodies. They can wear types of clothing they've never worn before. They get a lot of attention, wanted and unwanted attention from other people, which can sort of be, usually it's positive for patients, but sometimes it can be negative. We had one patient in particular, I distinctly remember, she was a teacher, and she had lost about 350 pounds. And we'd staged these procedures. We did a body lift, we did the breast, we did the arms, we did the thighs. And on our last procedure, and these were done in the hospital because they were covered by insurance. On the last procedure, the last day of her discharge, about 2 a.m., the nurse calls me up, Dr. Katzen, your patient is crying uncontrollably. I'm like, all right, what's the problem? So I talked to the patient, and she was terrified of going home. I'm like, well, what do you mean? Because I had taken off so much skin and fat. I'd taken away all this insulation, this protective skin over years and years of emotional trauma, and the skin was sort of protective. She said, to me, well, what do I do now as a skinny person? How do I behave? And I'm like, that's a whole different chapter, a whole different question. So by getting rid of the excess skin and fat, that opens up a new chapter in your weight loss journey. So we do see these tremendous emotional ups and downs.
Wow.
Yeah.
Also, I like to ask your patients if they're treated any differently, now that they've lost the weight. And like they always say, they were treated very poorly when they were big. They felt the need to be very funny or have a really great personality. And, as they lose the weight, they get all this attention. And then they also get treated differently by their friends and family sometimes. Yeah. Which sucks. Like their friends and family are jealous of them.
Exactly. And we've seen, families sort of dissociate from the person that's gone ahead and lost the weight and then had the plastic surgery afterwards. We've seen sort of friends sort of go away after the patient loses the weight and has plastic surgery. So, it's a mixed bag, what happens after you lose the weight and have the plastic surgery. So it's everybody's journey is different, but by and large, the losing the weight is very important for your health. You're going to live longer, you're going to be around longer, and then having the plastic surgery, that's sort of helping complete your weight loss surgery sort of on many different levels.
Yeah, and hopefully the people who, the good people in your life will stay in your
Absolutely.
life.
Absolutely.
Can you share a story or case that really stuck with you? Maybe someone that completely transformed in their life?
So we had one patient that had seen multiple doctors in his city, and the doctors said, for one reason or another, these are too complicated surgeries, you need to lose more weight. And his pannus hung down almost to his ankles. It was definitely past his knees, a very large mass. He had to basically remodel his car. The driver's seat had to be further back so he could hang onto the steering wheel. And very difficult for the patient to go through activities of daily life. Okay, so he came to us seeking advice. We suggested a penniculectomy. I think we took off about
72 pounds.
About 72 pounds, life-changing surgery, and now this patient is able to exercise, is able to lose more weight, is able to buy clothes off the rack. He had to get a new car, unfortunately, because they couldn't bring the seat back.
Fortunately.
Yeah, exactly. So these are sort of life-changing surgeries that can be done, and for us, just a day's work, and it can change someone's life.
Yeah, for him too. He said he was finally able to sit down and eat lunch on a bench with his daughter, like a picnic bench.
Yeah, so these are, very heartwarming stories.
And also he said that his pain, because he had cysts that would get infected on the pannus, he said the pain before was a 10 out of 10. Yeah. And the day after surgery, we interviewed him, and he said it was like a 3 out of 10 compared to that.
Yeah, so think about that. I mean, these patients are in a lot of pain because of the pannus and the infections and the chronic back pain. So sometimes these procedures are a pain-relieving surgery. We get rid of excess skin, we get rid of excess fat, and we relieve the pain.
How do you balance a patient's wish list with what's safest and what's achievable?
Yeah, so the patient's wish list, we go through what bothers them the most first, and we try to do that surgery first. So usually maybe it's the tummy or the lower body lift, and then we see what's number two, and we see if we're able to combine that surgery at the same time, depending on the timing of the length of the surgery and the length of the incisions. And it's very important for the patients to understand everybody is different, everybody is individual. There's only so much we can do. Sometimes we can't get you looking like Kim Kardashian or Brad Pitt or something like that. There are limits as to what we can do.
How often do you have to explain this to patients?
Yeah, for us it's pretty rare. I mean, most of my patients are very reasonable, realistic in their expectations.
What are some of the most common myths and misconceptions people have about plastic surgery after massive weight loss?
So some common myths are you'll never look normal. I highly disagree. You've lost the weight, you get rid of a lot of the excess fat, and with our shape surgeries, we're removing a lot of skin, a lot of fat to give you a better shape and a better contour. So yes, you can definitely look very normal, in fact, sometimes super normal. We take patients that are normal and we augment them. We put in maybe implants or maybe a facelift, and we make them look super normal or younger appearance. So that's taking patients that are perfectly normal, normal aging, and we make them super normal. That's cosmetic surgery or aesthetic surgery. What we're doing here is we're taking somebody who looks abnormal because of their weight loss, or maybe because of their weight loss, and making them look more normal. We're not making them look super normal, we're just making them look flat, getting rid of excess skin and fat. So that's what we call reconstructive surgery. So those are sort of two realms of plastic surgery. There's the aesthetic, normal to super normal, and the reconstruction where we take abnormal and we make them more normal. The other misconception is
Getting fat again.
Oh yeah, a lot of patients believe, or a lot of the public believes, they're just going to gain the weight after the surgery. Pretty rare. Okay, most of my patients are financially invested, emotionally invested, and physically invested because of the scars. So it's very rare that patients gain all the weight back after these procedures.
So patients often call their scars their battle scars because they had to overcome so much, to get to where they were with you and even after the surgery.
Correct. So a lot of patients are very comfortable with their scars, accepting of their scars, knowing that the only way to get rid of that skin is not with further diet and exercise, is to have a surgery to actually physically cut out that skin and to bring it back together, resulting in a scar. So when somebody else looks at somebody else's scar, their interpretation may be completely different than your interpretation of your own scar. So a lot of the patients are very accepting and are like, okay, I had this scar all the way around my body, but all that excess skin and fat is gone. Versus somebody else looking at that scar going, whoa, that's a terrible scar, it goes all the way around, and they may not be as accepting of that scar as the patient.
I think people are also just so dramatic about other people's scars, where it's one, none of their business, two, who's really going to see that scar? For the most part, most people won't see that scar.
Correct.
The other thing is people watch our videos and like to comment all the time, oh, that scar looks terrible. Well, you're looking at it on the table right after the surgery.
Exactly.
It looks so different in 2 years.
Exactly. And it takes, again, 2 years for that thing to heal. And there are a lot of other things we can do, the silicone, the silicone strips, the lasers, the steroid injections. Again, those are rare that we need that. But the pictures that you see on the table are just that. Pictures on the table, the patient just healed from the surgery. Yeah.
Right. And then back to what we were saying about patients getting big after having plastic surgery or reconstruction after massive weight loss. I think it's totally the opposite.
Yeah.
Because I've seen so many of our patients go on to train people or become personal trainers themselves, and really just become fitness influencers that motivate others that were in their same position.
Yeah, ambassadors, if you will, of, weight loss and then plastic surgery, sort of that completing that weight loss journey.
Yeah, it's really cool. And I've seen a lot of them be in group chats where they hold each other accountable for their workouts and stuff.
Yeah.
So I think it's quite the opposite. What advice would you give someone who feels ashamed or guilty about wanting their skin removed?
Yeah, so sometimes we get that.
Yeah.
Ashamed and guilty, that's more your personal interpretation. Sometimes also your family may make you feel that way, or your friends may make you feel that way. Maybe they are obese also. Maybe they don't want you to lose the weight subliminally, or maybe even objectively. So I don't think you should feel ashamed or guilty about wanting plastic surgery. It's helping you sort of achieve that body that you want, okay? So ashamed or guilty, you shouldn't feel ashamed or guilty. I would suggest you go to a plastic surgeon's office, again, board certified, experienced in this field, to get different opinions, okay?
Yeah.
And just to see what the options are. And we'll show you what can and maybe cannot be done.
I know people are also guilty about the money they're going to invest into their own surgery.
Yeah, so the money is a significant portion of the process. It is a big investment. But then again, you're trading out that excess skin and fat for a brand new body. So it's a trade-off.
Right. And this is also permanent, lifelong.
Correct.
Lifelong changes. And
Correct. I
think because it makes their quality of living so much better, it's totally a worth it investment.
It depends on the patient. Depends on, what the number is and their financial situation and everything like that.
What do you think about patients who are kind of price shopping because they think they can't afford a really good plastic surgeon?
Yeah, so I would go with the plastic surgeon who you can afford the most, all right? So if you only have X amount of dollars, try to find a plastic surgeon that can get what you want done with those X amount of dollars. I would also counsel patients to go for the most experienced plastic surgeon that you can afford. I would not suggest you go with a plastic surgeon that has never done these procedures before, or you being a guinea pig, or you being sort of done for promotional benefits. Go for the plastic surgeon who has the most experience and who you can afford.
Talking about costs again, do patients sometimes space out their procedures over a year or two so that they can make it more affordable?
Absolutely. So we have patients, usually these procedures are staged. We're usually not doing everything in one surgery, okay? So usually these procedures are staged at least a month apart, okay, to allow your body to heal, sometimes longer. We had one patient who came to the office 8 years after his initial procedure. And he goes,
wow.
Hi, I'm here, I'm ready for round 2. So we check our computer. He wasn't in the computer system because we changed computer systems. And we're like, excuse me, who are you? And we'd done our procedure about 8 years previously. So yeah, you can stage these procedures. Yeah, you can do them at a later date. Yeah, you can do, you pay for one surgery and then after that surgery, save up for the next surgery.
We actually had someone just message us on Instagram saying she had a breast lift with us like 2 years ago, and next year she's gonna do her tummy tuck in arms. So it's like, it's very common actually.
Yeah. So, and then patients will save up and they'll do a deposit. So that sort of keeps their incentive going to have these procedures.
Yeah, and in the meantime, they can be getting in the best shape of their
Yeah,
lives
exactly.
so to get you
Exactly.
really the best results. For listeners who aren't local to you, what should they look for when choosing a plastic surgeon for weight loss procedures?
So I think it's very important for you to go with the most experienced plastic surgeon you can find in whatever procedure you're looking for, even if you have to travel. Because complications can arise, and if you go to an inexperienced surgeon, they may not be used to those complications, not being aware of them, or not even knowing how to handle them.
Okay. All right. So do you have a lot of patients from out of state, out of country?
Yeah, so I would say about, at this point, I would say about 40% of my practice is out of state. Okay, out of California, and about half of those patients are from out of the country. So we get patients from all over the place.
How do these patients usually find you?
Patients usually find me on the internet. Okay, we have a lot of social media presence, especially on YouTube, Instagram. We do a lot of videos like this, so we do a lot of awareness.
And it's really cool actually to see like how your videos and everything can reach these people all around the world.
Absolutely, it's very cool. We have patients from everywhere. Europe, Asia, Africa, Australia, South America, Central America, all over the U.S., Canada, Mexico. So we got them from all over. We'll one day do a map with little pins on it to find all the patients. That'll be fun.
What's your take on revision surgery, and how often do you get revision patients from other plastic surgeons?
Yeah. So for my patient population, revisions are pretty rare. Okay. But with staging these procedures, if you're doing one procedure and then after that stage one procedure, if that stage one procedure needs a revision, a lot of the times that revision can be done during the second stage. And then if second stage or first stage needs a revision, you can do that during the third stage in the operating room, if they need revisions. But revisions are pretty rare. Sometimes the revisions can be done in the office, but revisions for my patients usually are pretty rare. For other plastic surgeons, we see them more common because they're coming to me for the revision of the problem. Okay, and typically those are dog ears. Dog ears are excess skin and fat at the end of the incision. Maybe it's at the end of the tummy tuck or the extended tummy tuck. Maybe the tummy tuck should have been a body lift to begin with, and that should have been done to avoid any dog ears. Maybe it's on the breast. Maybe mesh wasn't used and needs a more significant breast lift.
So, I mean, you've been in the business for over 25 years. Do you think you've seen more revisions the more experience you've got?
Yeah, so as that's sort of the general trend of plastic surgeons, as you get more experienced, people send you their revisions, or patients come to you knowing that you sort of have been doing this a long, long time, you've seen everything pretty much, and come to you for their revisions.
And are revisions more difficult surgeries?
Yeah, revisions are difficult, and they're probably more difficult than the initial surgery because of the scar tissue. Maybe too much skin was taken out, maybe not enough skin was taken out, maybe the scar is in not the ideal location. So you have to work with all those factors. Maybe it would have been easier if they'd come to me in the first place.
Right. I think a lot of times too, people are like, well, I kind of went, the cheaper route the first time around. I'm not going to do it again the second time around.
True.
All right. Is it ever too late to pursue body contouring after massive weight loss, even if it's been 5, 10, 15 years after losing all that weight?
No, never too late.
Okay.
There's always the age factor, but as long as you're healthy, that's the more important than the age factor. Again, we do it like a stress test. We check your heart. We check your carotid vessels, make sure there's no plaque in the vessels. We check your blood EKG, chest X-ray, everything like that. But if you're healthy, you can undergo these procedures. And say you've lost the weight maybe 20 years prior, and that skin still just won't snap back, you can still have these procedures.
Oh, awesome.
Yeah.
And what's like the latest you've seen someone come back, or the longest after they've lost weight?
I'd say probably about 20 years.
20 years?
Yeah, we
wow.
have patients sort of maybe in their teens. They had gained a lot of weight, lost a lot of weight, and then sort of weren't financially ready in their maybe late teens, early 20s. And then as sort of they aged, maybe mid-30s, they were able to get the finances together for these procedures.
I guess that would make sense too if they wanted to have children or whatever in the meantime.
True.
All right, how do you help patients prepare for recovery, especially if they're going to have limited support?
Yeah, so we always advise with these procedures to have somebody help you with the procedures.
So you're not allowed to be alone.
Correct.
Okay.
Correct. So we like some support. Okay. Either it's family, either it's friends, or maybe we help you hire somebody to take care of you during these recoveries. But that person's very important to help you get to and from the bathroom, get you food, okay, get you to and from the appointments, and if you're coming from out of state or out of country, to and from the airport. They're going to be taking care of the bandages, again, feeding you, making sure you have all your medications, making sure you don't fall down if there's a mobility problem, making sure there are no emergencies that need a 911 call.
Okay, got it. Do you think that if the person is squeamish, would they not be a good caretaker?
Yeah, probably not. You want to, ideally, the caretaker should be over 18 so they can drive you to and from the appointments and be able to physically hold you up. You know, if you're wobbly or falling down, you want that person to be able to either pick you up off the floor or either block that fall and get you back to bed. Yeah, and that patient should be able to take care of the drains if we're using drains for maybe a tummy tuck or a body lift.
If you could give one piece of advice to someone who's listening and they're starting their weight loss journey, what would it be?
Just do it. Lose the weight as soon as you can. Okay, that's really very, very important. Losing the weight fast or slowly really doesn't affect the skin. Being obese for an extended period of time, that affects your health and your longevity. So lose the weight as quickly and as fast as you can.
Yeah, and also your heart will really thank you for it.
And your joints, your knees and your hips and your ankles because of that sheer weight, and your kidneys because of all that fluid going through, and your liver. So all these organs are affected by being obese. So yeah, so if you're thinking about weight loss, consult with your primary care doctor. If your primary care doctor is not helpful, there are registered dietitians that can help. There's a lot of online support. There are gastric bypass surgeons. There are a lot of weight loss experts for you to get initiated. Maybe it's a weight loss program. Maybe they serve you meals through the mail, things like that. But just get started and avoid carbs. You know, avoid sugar. Pretty much try to eliminate sugar any place you see it. Okay. More and more studies show that sugar is really bad, maybe even carcinogenic. So try to get rid of sugar any which way you can. And then carbohydrates. Try to limit carbohydrates.
Yeah.
Maximize protein and also get your veggies and fruit in. Yeah, they have amazing apps now, a lot of tools out there. You can take pictures of food and it'll tell you how many calories are in it.
That's crazy.
So there are a lot of really helpful things that are out there. GLP-1s are really, really good, revolutionary medication. FDA approved, does work. Yeah, there are some side effects, but the side effects of being morbidly obese are much more detrimental than the side effects of GLP-1s.
Well, thank you guys for joining us on Plastic Surgery 90210. We hope we've answered a lot of your questions. Please leave them down below if you have any more. And we're going to actually have a part 3 next week. So we'll see you guys next week.
See you next week.
Dr. Katzen.
Thank you very much.
Bye.
Bye.